to the Canadian Science Policy Conference. My name is Denny O'Garindi, and I'm here with Dr. Carrie McAiney, Dr. Howard Bergman, and Dr. Isabelle Vedel. Thank you for taking the time to speak with me today. The three of you just wrapped up your panel on the Dementia Challenge, Facing the Rising Tide. Can you tell me a little bit about your panel and why you think it's important to discuss dementia at a conference like this?
So perhaps I'll just briefly start. Dementia is an extremely important challenge for the Canadian population, for individuals living with dementia, for their caregivers, and for society as a whole. The Government of Canada, through an act of Parliament, has been charged with creating what's called the Canadian Dementia Strategy. Our panel, at the request of the Public Health Agency of Canada, was asked to write a report on the evidence and best practices that will support their work in writing the Canadian Dementia Strategy. And we presented, not our report will be launched in January, but we presented the approach that we've been taking in developing this report and contributing to policy development. So that's why science and policy, we're the science and policy part at the same time.
You want to talk? So yes, I think so. There are a number of challenges that are going to be facing Canada and each of the provinces as the population continues to age and the number of individuals with dementia continues to increase. So we need to look at what it is that we're doing right now and how do we need to prepare our health and social systems to ensure that we're able to meet the needs of individuals and their family members. There's also some work that will likely be happening in terms of biomarkers in the future. And while that is a promising step, it'll also have impacts on our healthcare systems because there'll be increased demands for accessing those types of testing, and it'll have other types of repercussions on our healthcare system. So we need to think about those things now so that we can prepare for the future.
That's great. So on the topic of innovation, kind of moving a little bit away from science, what kind of role do you see for innovation in terms of engaging with individuals that have dementia or in terms of implementing some of the strategies that you've been working on?
I can speak to that. So I think that the whole field of engagement of individuals with lived experience is something that's relatively new but growing. And we need to think about doing that with individuals with dementia as well as their family caregivers or care partners. So there are groups that have been doing work in this area, but we are still at the cusp. So we need to learn how to engage individuals in effective, genuine, meaningful ways, and to work to really incorporate their perspectives in planning for future healthcare, social care, different innovations as well.
How do you see Canada on kind of the international stage, or how do you see Canada comparing to other countries in terms of addressing dementia through policy and being kind of more active on that side of things?
So we are quite in advance compared to other countries. In total, 32 dementia plans have been developed across the world. So we have the majority of our provinces developed dementia plans since the late 90s. So we are tackling this issue very seriously in Canada. And in terms of research and evaluation of policy implementation, we are quite in advance as well. While many plans have not been evaluated, here in Canada, we are doing evaluation of the processes and impact of policies and programs implemented for patients with dementia.
Okay, great. That's great to know. Are there any kind of standout barriers for you from a policy perspective in terms of what it is you're trying to accomplish?
So, policy barriers, let's say challenges. Policy towards Alzheimer's disease and dementia is very complex and touches many aspects of the healthcare system. So probably one of the main challenges is how do you take all this and ensure that it's going to be implemented in a coherent way in our healthcare system. It's easy to set up individual programs that will be isolated one from another. It's harder to develop programs that will be part of the healthcare system and change and improve, not change, but really improve our approach with older persons in general, older persons with dementia in particular. So implementation in a coherent way in our healthcare system, that's probably the greatest challenge, not to the policy development, but to the policy implementation.
Can I build on that too? And I think it actually extends even beyond healthcare. So we've got a lot of work to do in healthcare, but dementia really touches all aspects of a person's life. So thinking about transportation and housing and social support. So from a policy perspective, how do you ensure that the policies are going to look at the whole person and address all of their issues and not just focus on sort of individual silos or specific aspects of what they need?
Right, that makes sense. That makes a lot of sense. That's kind of one of my final points. I know the three of you are members of the Canadian Academy of Health Sciences, and your report you mentioned will be coming out in January of 2019. Could you provide a little bit of background in terms of perhaps some of the research that went into developing that report?
So our panel did not develop its own research. Our panel looked at the research, looked at the evidence, both internationally and in Canada, and also looked at, as much as we could, the emerging best practices. And so what our panel report will contain, and our panel report is not the dementia strategy, it's to support Public Health Agency of Canada developing dementia strategy. So it'll be comprised of how the evidence and the emerging best practices can inform the preparation of the report, of the plan.
That's great. Well, I look forward to reading that when it comes out. As my very last question, what do the three of you see as the greatest value of the Canadian Science Policy Conference?
Sure. So I think that opportunity to connect with policymakers and really try to bridge that gap between science and policy, because it's so important to be able to do that.
That's great.
Yeah, it's really key to learn more about the needs of policymakers so that we can incorporate their research question in our own research program, and we are very happy to see that there is so much interest for dementia and for health and social services, how they are organized and how they can be improved and so on.
That's great. Well, I look forward to seeing how your work kind of progresses, and thank you very much for taking the time to speak with me today.
Thank you.
Our pleasure. Thank you.